Good morning, girls. Today we will see National Rural Health Mission. The National Rural Health Mission was launched by the Government of India in 2005 with the aim of improving health care delivery and outcomes in rural areas of the country. The mission was part of the broader initiative to provide universal health coverage, reduce health disparities between rural and urban areas, and address the health needs of marginalized communities. National Rural Health Mission is considered one of the flagship healthcare initiatives in India, focusing on improving the availability, accessibility, and quality of healthcare services in rural areas. Objectives of NRHM. The primary objectives of the NRHM are to improve access to healthcare services, improve healthcare infrastructure in rural and remote areas, including the construction and upgradation of primary health centers and community health centers and sub-centers, ensure that rural populations, particularly vulnerable groups, uh, that is women, children, elderly and tribal, have access to quality healthcare services without facing financial or logistical barriers. To strengthen the rural healthcare workforce, ensure the availability of skilled healthcare professionals in rural areas, particularly doctors, nurses, and auxiliary nurses and midwives. The NRHM introduced the village health, sanitation and nutrition committees, which empowered local communities to actively participate in health decision making and delivery of services. To provide financial support for health services, provide financial resources to states for strengthening healthcare infrastructure and improving healthcare services at the grassroots level. NRHM aimed to reduce the burden of out-of-pocket expenses for rural households, thereby improving access to free or affordable health services. To address the health inequalities, targeting the rural and marginalized populations, especially those in tribal, remote, and backward regions. NRHM aimed to reduce health inequalities between rural and urban areas. To provide preventive and primary health care, focus on preventive health care initiatives such as immunization, family planning, maternal and child health, and disease prevention. Promote sanitation, nutrition, and health education in rural areas with special focus on reducing malnutrition and maternal mortality. Next, we will see achievements of NRHM. First one, improved health infrastructure. Significant improvements were made to healthcare infrastructure, including the establishment of upgrading of over 40,000 sub-centers, 10,000 PHCs, and 2,000 CHCs across the country. Next, upgradation of district hospitals and health centers in rural areas increased the availability of specialized services like emergency obstetric care. Next, reduction in maternal and child mortality. The Janani Suraksha Yojana has been particularly successful in promoting institutional deliveries, leading to a decrease in maternal mortality and infant mortality rates. Immunization coverage improved, leading to the reduction in vaccine preventive diseases among the children. Increase in healthcare utilization. The NRHM significantly improved the utilization of healthcare services, especially in remote and tribal areas, by expanding access to primary and secondary healthcare. Health awareness. There was an increase in awareness about the family planning, nutrition, sanitation, and preventive health care in rural areas. Improved health outcomes. There was a noticeable improvement in health outcomes such as life expectancy, child survival rates, and decline in the burden of communicable diseases. Thank you for the listening.